Hey there, if you're an occupational therapist and you work with anyone with a stroke, TBI, traumatic brain injuries, spinal cord injuries, and you have tone questions, stay tuned for this question. Someone sent me a message and had these questions. So, what would you recommend for a splint that would keep the wrist in extension while attempting to write? So, apparently, the story is this person has flexor tone. So, every time she starts to write, her wrist starts to curl in, and the goal is to write without any adaptive equipment. But when the person is writing, their wrist goes into flexion. I'm going to answer that question right here, right now. My name is Huang. I'm an occupational therapist and certified hand therapist, and I've been in business for over 10 years. And then about 5 years ago, I started Hand Therapy Secrets to help other occupational therapists develop their clinical skills and business skills, and also maybe become a certified hand therapist. Now, I'm a big fan of a certified hand therapist working with more neurological types of patients because I believe that all neuro patients are hand patients. Like every single stroke patient, spinal cord, like high level spinal cord patient, traumatic brain injury can present where they're having a lot of hand and arm types of issues. And I think it's important for us to really see these people as people who have like hand and arm issues that really need specialized services. And I would encourage you, if you're an occupational therapist, but you're not a certified hand therapist, I believe you too can learn more about the hand. And if you love neuro, thank goodness for you, because not that many people like, I would love to have more therapists like love what they do. And I think that when you have a better understanding of how the hand and arm work, then you'll be able to serve your neurological types of patients even better. So that's why I picked this question to answer. She sent me a message, and so if you send me a message, I need date of injury and stuff like that, and type of injury. So it was very vague at first. It was like, what splint would you pick if this is what they're trying to do? I'm like, yeah, but I don't know, because I need a little bit more information. I can't see without seeing. Does that make sense? So I was like, well, why does this person have flexor tone? Because it makes a difference in terms of what you're trying to do. So apparently this person had a traumatic brain injury. Let me see if never mind. I'm not going to pull it up. I believe this person came back and told me that they had a traumatic brain injury and they're trying to learn to write, but every time they write, their flexor tone kicks in. And so, they're working on wrist strengthening so that the person can hold onto a pen. So this person does not want to use adaptive equipment, which I totally understand, because I don't think I would want to use adaptive equipment over the long period, right? Number one is the question is, what is a splint? So if you're trying to do something that controls just the wrist, but allows the thumb to be free and the fingers to be free, then what you're looking for is a wrist support splint or a wrist cock up. It literally means the same thing. You can do a prefab splint, you can do a custom splint, but what you're trying to do is control the wrist, right? For someone who has tone, you have to make the determination, is it mild, moderate, or severe? Because when you decide if it's mild, moderate, or severe based on their tone, it will help you decipher what type of splint, not what type of splint. You already know the type of splint, it was a wrist support, but it will help you determine the material that you're going to pick to use based on their tone. Because or fit, let me say, like a thin material might not work very well for someone who has a lot of moderate to a lot of tone, whereas it might be really great for someone who has mild tone, right? If you are using a prefab splint, you also have to know the tone, mild, moderate, or severe, because you might need to make sure that their splint is a lot longer, because the length of the splint can give you more, control and leverage over it. You know how a lot of these prefab splints, they don't follow the splinting principle of 2/3 the length of the forearm, right? So if it's too short and the tone kicks in, it's not going to be strong enough to fight that tone. So then the wrist comes in, right? So that's what I would encourage if you are looking to pick a splint or create a custom fitted orthosis for someone with a wrist flexor tone. Really look at like the level of their tone, if it's mild, moderate, or severe. And it would just be a wrist support. So you definitely want the thumb to be free, and then you want the fingers to be free. You want it long enough so that um, it can support the wrist while they're working on it. The other thing I wanted to notate in here is the goal is to write without adaptive equipment. And I love that, right? But you can use a pen, but you can hold it in a different way to help manage the wrist. So if you look, and you have to do an activity analysis, what's required if they hold the pen like this, or they might hold the pen like this, right? What's their hand position look like, right? What does their hand position look like? What is their current functional skill? What is their current functional movement of their hand? So you have to evaluate the position of the hand and how they write, right? Now, based on their function, right? If they start to write because they're holding on to that pen, they're going to start to pull because of the effort that they're applying. So there's two things that you could do. You can make sure that they're using the right pen. This is not the right pen. This is a ballpoint pen. I don't have the other one. Oh, here it is. So when you're working with someone and you're working with writing, you want to start easy. So a ballpoint pen can be really hard to write with because you have to put a lot of force in it in order to see the ink. So I would recommend, I'm in love with Sharpie pens right now. So this is a 0.5, but I would encourage you to get the 0.7 or thicker, right? But this is like a gel pen, right? It's smooth, it glides, and you don't have to put a lot of force in order to see the ink and to see the writing. So anything that helps you get that better glide is going to help someone with writing. So think about the type of pen you're using, the type of ink you're using. If you're practicing and they're really still pretty severe, I would encourage you to get a marker. All types of markers can allow you to hold, to write, and have it glide versus having the pressure of writing. So that is a option. The other thing is, instead of just thinking about the pen ink and how it could help with the smoothness, is also how they're holding it. One way to hold it that's modified is in between the index and the long finger. Now, most stroke patients have a lot of intrinsics, right? Their intrinsics here is squeezing together versus curling down. So if you put the pen in between here and you hold and you do a writing, you would just hold the pen higher, because then now when you're writing, the arm will be on the table like this in a very pronated position with the wrist like this. And then they can rest their forearm down. So when they write, it's less likely that the tone kicks in. Let me know if that makes sense. Leave me a comment below. I know I gave you a few extra tips because your only question was what kind of splint would I pick? But it's not just about the splint. I think it's somewhat about the splint, and then somewhat about how you incorporate the writing, the use with the splint. That's going to give you the biggest difference in helping your patient achieve their functional goals, right? Let me know if this helped you. I've been thinking about doing a neuro series, talking about like hand therapy with neurological types of patients. So if this video has helped, like, subscribe, And actually leave me a comment below and let me know what you think and if I should do a neurological series on talking about like hand therapy and neurological types of injuries and how, as occupational therapists, we could help these types of patients become more independent. All right. Thank you for tuning in, and I will see you next time. And if you have questions or want to learn more about different splints, I'm going to include some videos here that you can go and take a look at wrist support splints.